Hello everyone, welcome to my channel. Today we have another allergy and immunology question for step 2. If you would like to see more step 2 questions, please like and subscribe. A 35-year-old man comes to the office due to 7 days of joint pain. The patient recently received antivenom due to a snake bite. The temperature is 39. Physical examination shows an urticarial rash over his back. Oral mucous membrane are normal. Blood pressure and pulse are normal and no heart murmurs are present. The remainder of the examination shows no abnormalities. Urine analysis shows 1 plus protein. Blood culture is negative. Which of the following is the most likely cause of the patient's current symptoms? So the patient is 35 years old and he has joint pain, he has fever, and we also have urticarial rash, and we also have proteinuria, a slight proteinuria. With that in mind, let's go for the answer choices. A Stevens-Johnson syndrome. A Stevens-Johnson syndrome is type 4 hyperreactivity reaction, and this one is T cell mediated, and you could see fever, you could see joint pain, you could see many of the symptoms you have here, including rash, but the rash is different. The rash is more sunburn like, and you can also see mucocutaneous lesions on the skin, which we are not observing here. So I'm not going to go with A. B, type 1 hypersensitivity reaction. Type 1 hypersensitivity reaction is IgE mediated, and it could lead to rash, but it doesn't usually lead to joint pain, arthralgia, and also it doesn't really lead to fever. And so it's not the best answer choice. C, pulmonary tuberculosis. Pulmonary tuberculosis is more about the lung. It doesn't really have dermal manifestations, and it doesn't explain many of the symptoms you have here, including the fever and the proteinuria. D, serum sickness. Serum sickness actually makes sense because the patient is receiving antivenoms, and some of these antivenoms have external proteins inside them that can cause serum sickness, and serum sickness can lead to immune complex deposition that could lead to fever, that could lead to joint pain, and it could lead to rashes, and the rashes are urticarial rashes. So it's very similar to what we have here, and also serum sickness can cause proteinuria, a slight proteinuria that we can observe here. So I would say D is a good option, but let's look at E as well. Bacterial endocarditis. Bacterial endocarditis can lead to fever, it can lead to arthralgia, and it could also lead to rash, but the rash we see in bacterial endocarditis is more sunburn like, and also we do not have murmurs here, and the blood cultures are normal. So E is not the right choice, and D is the right option. Thank you for watching, and like and subscribe.